Good evening and welcome to In Focus. I'm Kelly Swoop. A new twist in the opioid epidemic hits Maryland with evidence of 3 recent deaths here tied to a new super-strength synthetic. Jeff Hager takes a closer look now at this new threat.
There was a time not so long ago when only veterinarians could have gotten their hands on carfentanil, since it was only used to treat animals. But now it's being used to drug humans with deadly consequences. First came heroin, then efforts to save money and to increase the high by cutting it with a synthetic opioid called fentanyl, which carried 50 times the potency. And now a drug with a similar name that's put both of them to shame.
Fentanyl really alone has been driving a number of our deaths here in Maryland because of how potent it is, and carfentanil being 100 times more potent than fentanyl, we knew potentially could have an even greater impact.
It's a threat which has now become a reality after autopsies on 3 separate overdose victims here in Maryland turned up evidence of the substance. One victim in Frederick County and the other 2 in Anne Arundel County.
We were notified by the state of Maryland that 2 of our overdose deaths here in the county had carfentanil in their system. So carfentanil is a synthetic opioid that is often cut with heroin and is very, very dangerous. You know, it's absolutely amazing that this kind of stuff ends up on the streets. This is a type of drug that's used as a horse tranquilizer or a tranquilizer for elephants, so to speak. So it's amazing that people actually voluntarily put it in their body.
It is also so potent that just a few granules of the substance, no bigger than grains of sand, could pose a threat to first responders, the very people charged with racing against the clock to try to save the lives of overdose victims.
In Anne Arundel County, at least year to date, we have seen the number of fatal overdoses actually level out or even at a slightly lower level than we were this time last year. And we're attributing that to the increased use of naloxone by our law enforcement and our first responders, but also bystander naloxone. So anecdotally, we're hearing from our first responders that when they arrive on scene, that they are seeing more and more cases who have already been administered naloxone by a friend or someone who's with them.
The hope is that such progress won't be lost with a new powerful synthetic in the mix that will force first responders to wear protection covering their hands, their eyes, and their mouths to keep from putting their own lives at risk in the presence of carfentanil.